Hey everybody, welcome back to my Lyme MS treatment video blog. In this video, I think this is my third one. Today I'm going to talk about week 4 of my treatment in Reno, Nevada. And just a recap of this last week. I've had IVs every day this last week, and right now they've got me rotating between two different neurological boosting type IVs and then a liver detox IV. I've noticed that the liver detox leaves me feeling pretty well wiped out for the rest of the day after I get it. Um, I only had 3 pushes last week. I pushed Monday, Wednesday, and Friday. Monday I had no real reaction at all. Wednesday I had a really good reaction, probably about 2.5 hours of the baking, fever, and body aches. And then Friday's reaction was a really severe one. I had the violent, muscle tension, aching, and shaking for probably about 25 to 30 minutes, followed up with about 2.5 to 3 hours of the fevers and sweats. And it wasn't until about maybe 4.5, 5 hours later that I began to feel better after that. So Friday was pretty rough. The only other new thing to report from this last week was Tuesday and Thursday. I had a new treatment for my nerves in my legs. I underwent a neurological injection therapy where they gave me approximately 120 to 150 shots in my lower back and down each of my legs. Um, so probably close to about 300 shots all told. And I can tell you right now, it was not a fun procedure. Um, when they inject the medicine and it hits your nerves, it feels like a lightning bolt going down. And so it's certainly not a fun thing at all. But they do say that after a week or two, I should start to see a lot of improvement in the neurological function of my legs, which would be great. If it means I can regain my full ability to walk again, man, you can stick me as many times as you need to. So um, that's basically, what happened this last weekend, or rather this last week. And so for the rest of this video, I'd like to talk specifically about Lyme disease. I know I mentioned in a video before that I was going to talk about the bacteria itself and testing. So let's kind of roll into that. The bacteria itself is called Borrelia burgdorferi. And this bacteria is a spirochetal bacteria, meaning it's a corkscrew-shaped bacteria, similar to syphilis and other types of spirochetal type bacteria. But this one, it really is the nastiest bug ever known to man. It's an insect vector-borne illness. Don't let anybody fool you into thinking that it's only passed by the bite of a tick. It is not. It is an insect vector illness, meaning that any insect that passes blood between hosts can give you this bacteria. And that includes mosquitoes, biting flies, chiggers, fleas, ticks, you name it. Okay? So the next time you go out in the woods, if you're going to be out camping or things like that this summer, make sure you wear like a dog and flea tick collar, on your ankle. Use a lot of insect repellent and that kind of thing to protect yourself. As I said, the bacteria is a spirochetal bacteria, and its motility allows it very easily to screw into the tissues of your body. And once it hits your bloodstream, it can get anywhere in your body it wants. And depending on where it sets up shop, that's going to kind of determine where your set of symptoms are going to start presenting from. And a lot of the symptomology is, it overlaps into other illnesses, other autoimmune illnesses like, Parkinson's, multiple sclerosis, MS, Lou Gehrig's disease, Crohn's disease, Alzheimer's. I mean, any number of autoimmune illnesses Lyme can present as those illnesses. So if you've been diagnosed with any of these illnesses, you must have your doctor or physician rule out or confirm Lyme disease. Okay. Um, and I'll get into how to do that here in a little bit, but I want to get back to the bacteria itself. Now, the reason the bacteria is so nasty is because not only does it have a motility mode, it swims around, and while it's swimming around, it's releasing these lipoproteins into your body, which is essentially a neurotoxin, okay? And it's one of the reasons why you feel so crappy all the time when you have it. It's because your body's continually having to deal with this added stress, this toxic stress in the system. And also while it's swimming around, it has antigens on the outside of its body. And these antigens, you can think of them as an antibody marker, okay? And it's what the immune system uses to program itself that, hey, this is a bad guy, okay, I need to go kill it. Well, while it's swimming around, it's rubbing its antigens off onto your healthy cells, okay, marking them as bad, okay? So this is where the autoimmune response to a chronic Borrelia infection comes from. It comes from your immune system keying off the antigen and not knowing the difference between a good cell and the actual bacteria. Now, as I said, the bacteria is really vicious because whenever it is presented with an environment that's hostile to itself, it has a whole bunch of defense mechanisms. It can turn itself inside out and become what's called an L form, or a cell wall deficient form, where it is no longer presenting the protein chains of its cell wall to the immune system. So it effectively becomes invisible to your immune system. And your immune system can't produce antibodies for it when it's in this form. And it can hang out in this form for a long period of time. It can also burrow into a cell of your tissue, colon tissue, heart tissue, lung tissue, muscle tissue, nerve tissue, whatever, and it can become a cyst. And there it's protected by the cell wall of whatever cell it's infecting until that cell goes through its normal life cycle, goes through apoptosis, dies, and then the cyst is re-released back into the system, becomes a spirochete again, swims around, begins wreaking havoc, etc. So this is where the chronic relapsing condition comes from. And at any given time in your body, you can really only attack maybe 10 to 20% of this stuff because the rest of it's hidden and hiding or sequestered from your immune system. So, how do you test for it? How do you figure out that you've got it? Well, the CDC and the IDSA, the Infectious Disease Society of America, have made it very difficult to get good testing. And the reason why is because they use a two-tiered testing system. They use an ELISA test, and then they use a Western blot test. So whenever you go to your physician and you say, hey, I think I have Lyme, or I was bitten by a tick, I need to get tested, I need to see if I've got Lyme disease, your physician will most likely take your sample, they'll send it to LabCorp or to Quest laboratories, which are the two main laboratories in America. And that lab will do an ELISA test, and if that test is not positive, they stop. If it is positive, they do a Western blot as a confirmatory test. Well, the ELISA is one of the least accurate screening tests ever devised. The CDC itself even admits that it's not a very accurate or good screening test for Lyme. It's really only about 20 to 30% accurate, resulting in a lot of false negatives for people that actually have the illness. The Western blot isn't too much better. It's more specific and more accurate, but it still has its flaws too, because it does not allow the testing for the two most important antibody titers to properly identify Lyme in your system. And those are OSP-A and OSP-B, otherwise known as bands 31 and 34 on the Western blot. The test kits for LabCorp and Quest don't even come with the materials to test for 31 and 34. And the reason for that is because 31 and 34 are considered reserved bands. They have patents on them that members of the IDSA are co-owners of, and they license these bands, these parts of the bacteria, out to pharmaceutical companies for vaccine development. That's all fine and dandy. They created a vaccine in the 90s. It was on the market for about a year and a half, and they discovered that anybody that got it got chronic Lyme disease, so they took it off the market. Well, even though they took the vaccine off the market, they did not overturn the reserve status of bands 31 and 34. Okay, these bands still can't be tested for. Okay, and then the reason they were reserved to begin with is because anybody that has the vaccine is going to come up positive on those bands, so they don't want anybody testing for them, because of the vaccine. But because there's no vaccine, why haven't they overturned the rulings for testing for those two most important specific bands that don't cross-reference to any other kind of bacteria? They're specific to Borrelia. The other bands on the Western blot, Borrelia might have them, but other bacteria might also have them as well. Why wouldn't you want to overturn that? I don't know. I'm not going to get into the conspiratorial aspect of all of that. There is only one lab in America that properly tests for Lyme disease, and that lab is IGeneX Labs in California. They test according to the CDC guidelines, but they also test according to the ILADS guidelines. The ILADS is the International Lyme and Associated Diseases Society. Okay? And that society requires the testing of bands 31 and 34 on the test. So if you want to be accurately tested for Lyme, you have to be tested at IGeneX. This is not a shameless plug for them. It's just a fact. They're the only ones in America that do it. I know I've kind of presented a lot of information here, and I'm kind of running long on time. And I know that there's probably some people out there that might have questions. So don't hesitate to leave a comment here on this post. And let me know what your questions are, and I'll be happy to give you all the information that I've got. It's a lot of reading. Some of it's kind of technical. But if you suspect that you have Lyme disease, or if you have any of these other autoimmune illnesses that could have Lyme disease as a factor, compounding your problem, don't hesitate to get a hold of me, and I'd be happy to give you all the information that I've got on this. With that, I hope everybody has a great 4th of July, and I will record another video in probably 7 days. So thanks for watching, and I hope you guys have a great week. Bye.